Joining us today. My name is Shira Samet. I'm a nurse. I work at NYU Lincoln, Brooklyn. I currently work in labor and delivery, but nurses are very well rounded, so I am very comfortable speaking with you today about how to maintain a healthy heart and helping you learn a little bit about what that's about and what to do if there are some issues that arise with your heart and complications that can happen. So if it's okay with everyone, I'm happy to get started. If you have any questions, I'm happy to answer them at the end. If anything is pressing or you really want me to clarify something, please feel free to speak up. I want this to be an open dialogue and a discussion. I'm here for you. This is about making sure that you have the knowledge you need to keep you healthy in your environment.
Are we ready?
Ready.
Yeah. Let me go to the bathroom quick.
Okay, I'm gonna get started. So your heart is a muscle. Like any other muscle in your body, it needs oxygen to do its job. So oxygen is essentially the food that makes your heart work. So your body runs on fuel and your heart will run on oxygen. Heart disease is any condition that disrupts the heart's ability to pump effectively. So for your heart to run effectively and work well, it needs to pump blood to the lungs, pick up some extra oxygen that your body has taken in from the environment, and then distribute it to your body, but also be able to distribute it to its own self to be able to pump efficiently and get your body the oxygen and necessary air it needs, as well as itself. Okay. So sometimes people don't understand that. They think that my heart just gives the body the oxygen it needs, but it also needs to have its own oxygen to be able to function properly and its own blood supply to function properly. So that's kind of what the heart looks like. And if you can see there are different chambers in the heart. There are 4 chambers. The bottom chambers pump blood to the outside heart, and the top chambers to collect blood from the rest of the body. And I'm sorry. Does somebody have a question? Okay. So the bottom chambers distribute the blood to the rest of the body. And the top chambers collect the blood that's coming in from the rest of the body. And if you see in the picture here, it's hard for me to point, but if you see in the picture here, there are many, many vessels coming off the heart, and those supply blood to the heart itself. And if those get blocked, that can lead to some issues with the heart as well. So what are some diseases and issues that can happen with the heart? These are some examples. Coronary artery disease. So coronary refers to the heart. So any arteries that lead to the heart itself, if they become inflamed or swollen or blocked, this is what we call coronary artery disease. Some other examples of heart disease are arrhythmias. So your heart actually has an electrical current that runs through it to keep it beating at a specific pace, right? You have a heart rate, and that heart rate is controlled by the electrical currents that are running through your heart. And if there is a disruption in that electrical current and the heart isn't beating according to the normal way, we call that a dysrhythmia or an arrhythmia. And some of those arrhythmias can be fine and you can live totally fine with them, and some need some intervention and you need to be monitored more closely by a doctor. Then there are valves. Valves are between those chambers in the heart. There are 4 chambers. There are valves that control the flow in between those chambers. They open and close with each heartbeat. And if there's something wrong with those valves, either from long time use, right? We live very long lives, thank God. Those valves can become, damaged, or some people are born with damaged valves. So those are disorders that involve that. And then there's something called congestive heart failure. Congestive heart failure is when your heart muscle isn't, it's pumping, the rhythm of the heart is fine, but there's something wrong with the muscle and it's not pumping in the way that it should. And so the heart is not able to circulate appropriately and your body becomes filled with fluid. And that's when you see some people with very swollen legs and they sometimes get water on their lungs. And that's the term called congestive heart failure. And there's a few different processes that are involved that may lead to that, but that would get diagnosed by your cardiologist, the doctor that deals with your heart specifically. And then I'm sorry?
May I ask a question?
Yes.
I have AFib. Which one it belongs to? Which?
That's an arrhythmia. So fibrillation is when your heart rhythm is kind of almost quivering. So the normal rhythm in the heart, which should be a normal, the atria, the top chambers of the heart contract, and then they send down an electrical current to your ventricles, and it signals the ventricles to contract. The atria are not contracting the normal way because the electrical current is not 100% correct in that. So we call that atrial fibrillation, and that's an arrhythmia. That can oftentimes lead to other kind of heart diseases. So it can be a progression, sometimes cardiomyopathy, which is the next one that we're going to get to, where your heart muscle is oversized because it's been contracting very, very hard and very, very differently. And so when we overuse a muscle, just like a bodybuilder, right? They use their muscles very much and their muscles get very, very big. But when the heart is contracting ineffectively, the bigger the heart gets, the less effective it can pump. Right? So that's kind of, it can lead to a progression, which is why this discussion that we're having here today is so important, so that we can do whatever we can to keep our heart as healthy as possible. And then if for some reason we already have developed any one of the examples here or any of the other kind of less common cardiac or heart diseases, we can prevent them from getting worse by doing the steps that we're going to talk about in the next slides, okay?
Thank you.
You're welcome. About 650,000 deaths each year are attributed to heart disease. So we're gonna spend some time now, just like I said, talking a little bit more about it and figuring out ways that work for everyone to help prevent progression of disease if we already have it, or preventing us from getting the disease if we don't. Okay, any questions about that? Okay. So what are some risk factors for heart disease? When we talk about what a risk factor is, it means some things that we may have that increase the possibility of us getting this disease process, okay? So we talk about two kinds of risk factors, okay? Some are modifiable, meaning they're things that we can control and try to prevent or change. And some things we are just born with and we can do nothing about except for try to prevent the modifiable risk factors for heart disease. So what are the non-modifiable risk factors? Something that we have no control over. So genetics. If you have a parent or a family member who had heart disease, like coronary artery disease, you are at slightly higher risk for developing the same kind of heart disease. Your age, right? The older we get, the more at risk we are for diseases, and the heart disease is no different than that. And gender. Women have their heart attack at an older age than men do in general. If they're going to have a heart attack, it usually occurs at a slightly higher age, but their chances of survival after their first heart attack is slightly less than men. And there's reasons for that, and we'll go over that at the end. We'll talk about that a little bit later. And then for men, they are at higher risk at a younger age, but their chances of survival after first heart attack are slightly higher. But these are things we can't control, right? We were born as a male or a female. Our age is our age. Thank God we get up there in age. That's a healthy thing. And our genetics are our genetics. So what we can do is try to work with our modifiable risks, right? So these include cholesterol, our blood pressure, weight, physical fitness, diabetes, and smoking. So these are just some of the risk factors, but these are the most common risk factors. So there are other risk factors. These are not everything that can lead to heart disease, but these are the most common ones, okay, according to the CDC, the Centers for Disease Control. Cholesterol can also be genetic. So some people have a predisposition in their genes to have high cholesterol, but we can modify how high our cholesterol gets by watching our diets, okay? Blood pressure is also something that is a modifiable
I
risk
lost
factor.
her.
I'm sorry? Shirley, are you speaking? Okay, I can't hear. So if somebody's trying to ask a question, you could unmute yourself and then I'll be able to answer, okay? Blood pressure is also something that even if we have a pre-genetic disposition to having high blood pressure, it's something we can control. And that's why it goes on the list of modifiable risk
A question.
factors.
Can I ask?
Yes.
I have a problem. I have a high cholesterol and I'm allergic to all the statin. And no matter how much I watch, you know, question mark, my cholesterol keeps rising. It's about 260, 270 altogether.
Okay, so that's a discussion that you can have with your provider, but cholesterol, as we can go over later, is a combination of the high cholesterol and the low cholesterol, the low density lipoprotein and the high density lipoprotein, HDL and LDL. And sometimes increasing your ratio of good cholesterol to bad cholesterol is also helpful, and not just lowering the number. So there are definitely things that a person who cannot take a statin can do to help minimize their risk for heart disease.
The doctor, another question, the doctor prescribed me some kind of drug. It's omega-3 acid and another one to try, VASCEP, Vasepka,
Okay.
VASCEPA. They said it should lower it 20%. I didn't see no change, but I still take.
So it's very important to remember that medications alone do not do everything it needs to do for our cholesterol. So the diet changes, which we'll go over in a little bit, and then trying to increase the ratio, like I said, the high, the good kind of cholesterol versus the bad kind of cholesterol is also helpful at decreasing our risk for heart disease. So even though the number is high and it may stay high, and this is a conversation that you need to have with your doctor, what you can do to increase the amount of good cholesterol you have so that that ratio is where you need it to be, even if your number remains high. Has your doctor discussed that with you?
They try, but it doesn't work. They always say, what are we going to do with you, Mr. Sherm? What are we going to do with you?
Oh, I'm sorry.
So it's a
we
little
can go over,
scary.
you can email me afterwards. I can reach out to some of the dietitians and see if they have any tips. But that's, it's
You have
that's
a
not
number,
like
a
the most
telephone
typical
number?
situation. I'm
Do
sorry.
you have a telephone number that I could?
Yeah, at the end of the session, Shula will make my contact
Okay, I
information
appreciate it.
available. Okay,
Thank
we'll
you
see
so
what we
much.
can do to try to help you. Okay.
Thank you. Thank you.
Okay. So we're going to go back to just the modifiable risks. There's blood pressure. Like I said, some people have a genetic non-modifiable risk factor for having increased blood pressure, but controlling it and maintaining it decreases your risk for having severe heart disease, okay? Then also controlling our weight. We know that obesity and being overweight attributes to heart disease. So if you control the weight and keep it down, or lose some weight if you have some excess weight, that is helpful at decreasing the risk for heart disease. Physical fitness, the heart is a muscle. So if you are physically fit, it means your body is working your heart better and more efficiently than if you are not physically fit. So cardiac health and cardiac routines for exercise are very, very helpful. If you can't do those because you're not physically able, just routine walking, not having a sedentary lifestyle. So, if it means instead of calling somebody to bring you a cup of water, get up and go get it yourself so that you are physically moving. That is very helpful at decreasing your risk for heart disease. Diabetes, again, non-modifiable risk factor is that some people are predisposed to having diabetes, but keeping it under control and following your doctor's regimen and taking your medication as prescribed and eating the appropriate foods will decrease your risk of having heart disease secondary to your diabetes, okay? And then smoking. There are many, many dangers that come along with smoking, and heart disease is just one of them, and it's a pretty big one. It increases your risk for high blood pressure, which increases your risk for heart disease, and it's just not good for your heart at all, especially if you have some of those risk factors of high cholesterol. Your vessels get more constricted, so whatever oxygen needs to get through to your heart has a harder time getting there. So one of the modifiable risk factors that can definitely help prevent you from developing heart disease would be to stop smoking if you're able to help prevent heart disease. Keeping your heart healthy. So like we just went over, lifestyle changes can definitely improve your heart health and can also prevent you from having complications from your heart disease if you've already had it. So somebody who has coronary artery disease, meaning the arteries to their hearts are narrowed with plaque or extra cholesterol, they don't need to have complications from that disease if they maintain a healthy heart by making some lifestyle modifications. And that's what we're going to talk about. Okay. Any questions about that? So like we said, if a person smokes, it's very helpful for them to quit smoking. If a person is overweight, they can lose some weight. We could limit stressors if possible. I have a very taxing job, so it's hard for me to limit my stressors, but whatever we can do to kind of stop the stressors from being overtaking on our lives is good. So you can do some meditation, you can learn how to relax, and then if the stressors are still there, we can try to, like I said, learn how to cope with them, okay? And then definitely exercise. Exercise is probably the best way to help keep your heart healthy. When you exercise your muscle appropriately, then your heart functions better and helps maintain its own health. So if it's walking some stairs a couple of times a day, because I know COVID has impacted how much we can get out, that's good. Whatever you can do to keep your body moving and your heart exercised is better than nothing. So don't say, well, I used to be able to go to the gym and walk on the treadmill twice a week. I can't do that now, so I'm not going to do anything. It's important to continue doing the little things you can do. Yesterday at work, somebody said, I decided that I'm going to squeegee my shower doors from top to bottom every day, 15 times a day. So she raises her hands up, she bends her whole body down, and she goes up and down because that's some movement that she wasn't doing before, and that is helpful, okay? Sorry. So if we said that weight is one of the modifiable risk factors for heart disease, and blood pressure can be controlled to modify our risk factors for heart disease, then we can change our diet to be able to prevent our heart from becoming sick or getting worse if we already have heart disease. So what does a heart healthy diet look like? So we limit our salt intake. Salt is one of the things that can be very detrimental to us if our heart is under stress, especially if we have high blood pressure. So we have a lot of things that are like a salt substitute, so that we don't stress out our heart anymore. They, instead of having sodium in the salt, they replace that with some potassium. So you just want to make sure that you verify this with your provider, because some people have to limit how much potassium they take in. So you just want to speak with your doctor and say, if I'm going to use a salt substitute, because I learned that I should limit my sodium intake for my heart, is this something that I could use? There are also many salt-free spice mixes that allow us to have flavorful food without having to have any salt at all. McCormick makes a lot of them. You want to limit red meat. You want to limit the fats, especially saturated fats. So it's hard to remember kind of what are saturated fats. So some examples are the fat that you find in red meat. The skin on your chicken would be a saturated fat. Butter and a lot of the hard cheeses have a lot of saturated fats. You definitely want to limit the amount of deep fried foods you have if you are trying to watch your diet for heart disease. So, you know, I always say everything in moderation. So if you want to have it once a week, that's okay, but you shouldn't be having those things, you know, every day of the week if you are trying to keep a healthy heart. And you want to increase the amounts of fruits and vegetables in your diet, and some nuts are also very healthy for a healthy heart. Okay, I'm going to play this video here if it will work. Sorry. Can you see the video on the screen? Is it coming up on your screen?
And usually can't feel it. According to
Is it coming up on your screen?
No, there's no video yet.
Okay, I'm just going to move it over to my other screen. Let's see. It's on mine. I
the
have,
American Heart Association,
hold on.
more than 7.
Let me see. One more second, guys. I'm sorry. Can you see it now? Do you see that video on the screen?
79 million
Do you
Americans
see it?
have cardiovascular disease. It remains the nation's #1 killer.
Yes.
Yes, now
Thank
we see
you.
it.
Sorry about
Just
that.
make it a little high, louder if you can.
Sure.
You can't see it and usually can't feel it. According to the American Heart Association, more than 79 million Americans have cardiovascular disease. It remains the nation's #1 killer.
Cardiovascular disease still kills 40 to 50% of the American public. It is so far more than any other disease process that it is truly a staggering mountain that we have to climb to cure it.
But even simple changes can help fight heart disease. The Cardiovascular Institute at Beth Israel Deaconess Medical Center offers these 5 steps. First, know your family history. Even though you can't change your genetic makeup, family history is an important indicator of your risk of heart trouble. Learn not only if your parents, siblings, grandparents, and others had heart problems, but when.
If they had it in their older years, in their 70s or 80s, that's very common, and many people have that. But to put yourself at risk for having heart disease at a younger age, it's really having a relative that's had the disease at a younger age.
Those with a strong family history of heart disease may need to see a doctor more regularly for tests and checkups. Second, eat a handful of nuts every day. Diet plays a big role in controlling risk factors like blood pressure and cholesterol, and adding a quarter cup of unsalted walnuts or almonds could serve a couple of purposes.
Nuts are great. They offer some healthy fats, which might increase the good cholesterol. They offer fiber,
which is always good for lowering cholesterol, keeping yourself full, to hopefully monitor portions better. And they also incorporate some protein in your diet.
Next, skip the elevator. Take the stairs. Not just once in a while, but whenever you can. The American Heart Association recommends 30 minutes of exercise most days of the week. But that time could be split up into 10-minute intervals. Every step adds up. Also, know your goal weight and work out a plan to reach it. Extra pounds put more stress on your heart. Being overweight also increases the risk of high blood pressure, cholesterol, and diabetes.
Even a small weight loss, even 5 to 10% of weight, will have an impact on some of the different risk factors associated with heart disease.
And finally, see your doctor every year. Blood pressure, for example, can slowly creep up, and catching hypertension early is key. Your doctor can decide which tests you need each year.
Keeping on top of it with a regular check with a professional is important.
You can see it, and usually can't feel it.
Give me 1 second. I'm going to go back to the slides. Can you see the slides again? Do you see the slides, everyone?
Yes.
Okay, thank you so much. I hope that video was helpful. Does anybody have any questions about that? Okay. So we've done, you guys have done all the things that you need to do. You worked on your heart, you changed your diet, you've gone to the doctor now every year, and your doctor says, we found some risk factors that we need to modify to be able to keep your heart healthy. So they might prescribe a medication that will treat blood pressure or cholesterol, as some of you have discussed already, that diabetes and blood thickness. When we talk about blood thickness, some people may have already heard the term a blood thinner. When your blood is really thick and gooey, and it has to go through those narrowed vessels around the heart, it can be too thick to get through it. And what happens is the blood kind of stays and becomes stagnant. And when that happens, our bodies are meant to create blood clots. And little blood clots that develop in our coronary arteries are what can cause a heart attack, right? So the blood supply to the heart becomes blocked off because a little clot has formed and blocked the rest of the blood supply. So your doctor may decide at some point that you need a blood thinner based on a lot of other things that I cannot tell you what the doctor would decide for you is your risk factors for this, that you may need a blood thinner so that we make sure that your blood can flow smoothly through the arteries and the vessels around your heart. Any questions about that? It is important that if your doctor prescribes any of these medications, that you make sure that you take them as prescribed. If you don't feel well after you take them or something seems amiss, you make sure you reach out to your provider. Don't make any decisions about stopping or starting medication. I'm sorry, just 1 second. Stopping or starting any medication without your doctor's input. Continuing to take these medications as ordered can be life-saving for you, but also taking them when you don't feel right can also be problematic. So make sure you stay in constant contact with your doctor. As mentioned earlier, diabetes is one of those modifiable risk factors, and keeping your sugar well controlled in your blood is very, very helpful for your heart. When your sugar levels in your blood are high, just think to yourself, my blood looks like syrup, right? So think about that maple syrup that is thick and goopy, and it's harder for it to flow through all your vessels, but especially the small vessels around your heart. So keeping your diabetes under control and your sugar at normal levels for you, as discussed with your doctor, is very, very important. But not only taking medications to control your diabetes is helpful, make sure you're following your diabetes diet when it comes to that, okay? Sometimes we do all the things that we need to do. Here we go. Sometimes we do all the things that we need to do, and sometimes our hearts don't cooperate and they still are going to have disease, and we need to treat those diseases. So we've taken our medicine, we've done our diet, we do our exercise, we do all the things that we're supposed to do, but you may go to your doctor and he may say, I think that it's time for you to have some sort of procedure because you have an arrhythmia that we need to control. So some of those procedures include an angioplasty, where they kind of like go in and they kind of scrape out the vessels to make them less thin and they have more room to let that blood pass, which is healthier. You may need, if you have an arrhythmia, you may need a pacemaker to help make sure that your heart is, those electrical currents are flowing as appropriate as possible in your heart. So those are things that you may need. And then there are many, many other types of heart procedures. And if that is something that you need, they will be discussed by your provider. Ultimately, if there is, a cardiac event where your heart really stops or you need something, there's procedures that are called a bypass. Many of you may have heard it, and those get diagnosed later on, and they will be treated by your surgeon. And it's a very complicated discussion. And if you have any questions about that, we can talk about that afterwards. We have discussed here all the things that you may want to do to help prevent heart disease and to keep your heart healthy. But we do know that heart attack is a leading cause of death amongst Americans. So it's important to recognize that if you have the signs and symptoms of a heart attack, that you need to call 911 and get yourself help. Or if somebody that you're standing next to seems to be exhibiting signs of a heart attack, that you can call 911 to help save their life as well. So what are those signs and symptoms? Okay. The most typical one is somebody's going to like grab at their chest. I'm sorry that you can't see me very well, but they will grab at their chest. They may say that they have crushing chest pain. It feels like somebody is stepping on their chest. They may have pressure or squeezing. Many people report pain in other areas, like in their jaw, arms, back, or neck. Often they have nausea, lightheadedness, and cold sweats. You'll see them very, very sweaty, but they're not hot, right? They won't feel like they're very, very hot. They just feel very, very uncomfortable. Women do not exhibit the same signs of a heart attack. They don't always show the most typical signs, like that crushing chest pain. More often they have like pain in their jaw, some nausea. A lot of them say it's indigestion. And earlier I mentioned that women are at higher risk from dying after their first heart attack. And often it's because it goes unrecognized. So even in an emergency room, a woman could be showing signs of a heart attack that are typical for women, but they're working her up for a stomach issue, or they're trying to figure out if she has a bad toothache or a headache, right? So it's very important at the end of this session here that you understand that sometimes women can report indigestion and severe pain in their upper body that's not to do with their chest, and it could be a sign of a heart attack, and you could end up saving a person's life because you recognized that sign. Okay. If you experience any of these symptoms, it's important to call 911 immediately. Heart attacks that are caught within the first hour can be treated, and they have a much, much better outcome. So some of those treatments that we discussed earlier might be some of those invasive cardiac procedures that we discussed. Sometimes a person might need a bypass. Sometimes they just need a simple dose of medication. That's for the doctor and the emergency medicine team to decide. The person's role who's observing the heart attack, or the person who's showing signs of a heart attack, is to call 911. if you are the person that you are talking about or a loved one, if it's okay with your doctor, you can take aspirin. Aspirin for preventing like little blood clots that your doctor may have you on is like a baby dose. It's like 81 milligrams. If you think you're having a heart attack, the recommended dose is 325 milligrams. This session here is not to tell you it's for sure okay for you to take it. It is for you to start a conversation with your doctor to say, I went to this session and a nurse said that if I think I'm having a heart attack, I should take some aspirin. Do you think that that would be okay for me? Okay. Because I cannot tell you that you can take medications. That is not my job. I am a nurse. Your doctor is the one to tell you it's okay for you to take medications. Some people have a history of like, angina or a heart disease, and their doctor may have prescribed for them nitroglycerin. What that does is dilates the vessels around the heart, so that if there's a blockage from blood getting through to keep that oxygen going to the heart muscle, it might dilate those vessels to help it get through for a short time period. And if your doctor has prescribed that for you and you think you are having a heart attack, you can take the nitroglycerin as ordered and then call 911 to make sure you get the help that you need. Any questions about that?
Sorry.
Um,
Sorry.
Okay, I'm going to show you a short video here. Give me 1 second while I switch this screen share, because it's just not working as it would have worked if this wasn't a regular Zoom call. So please accept my apologies. Okay.
It's not normal. That's so normal. Yes.
Can everyone see the screen here? Yeah, can you shake your head for me?
Okay. Yeah.
Okay, here we go.
Worldwide, a person dies every 2 seconds of heart disease, often far away from medical help. HeartInform is a breakthrough in medical technology
sorry, guys.
that immediately detects.
This is the checkers game where grandson and granddad will bond. This is the pool where cannonball records will be broken.
Sorry, just 1
And this is
second.
the kitchen where the new boyfriend will unofficially become family. These are the Verbo vacation homes waiting for you to fill with your family. Your together awaits. Find it with Verbo.
Okay.
Hi, I'm Dr.
I hope-
Hello. I lead
Where
the
is this?
cardiovascular prevention and rehab
Hold on one
program
second,
at the
guys.
Peter
I'm
Monk
sorry.
Cardiac Center and Toronto Rehab Institute. We mostly help people who've had heart attacks and other coronary events get back on their feet.
So I hope that video was helpful. I think a visual of the signs and the symptoms is helpful for me also, because I could tell what it looks like. So I find that video to be very, very helpful. I think that in 2021, I think it's very important to go with mentioning that Harvard Health report that people with pre-existing heart disease, meaning that they're already diagnosed with some heart condition, are 2 times more likely to develop the severe form of COVID-19 if they do get sick with COVID. So it's important to try to implement these steps into our lifestyles to help keep our heart healthy. And then also to try to keep ourselves safe from COVID. If we go outside, we should follow all the rules that are recommended. I can't stop myself from saying that because I'm a nurse and I care very deeply about all of you. Heart disease still remains a strong predictor of poor outcomes from COVID-19, okay? So if you are someone with heart disease, please be extra careful to social distance and wear a mask whenever it is necessary for you to be outside, if it is necessary for you to be among others. I wish you lots of heart health and I wish you lots of general health. And I'm here to answer any questions for you. And I hope you learned something from today. Thank you for joining me.
Thank you so much, Shira, for taking time out of your day.
My
Ladies,
pleasure.
if anybody has any questions or would like the PowerPoint, just call me or email me, or you could add your email to the chat below. Anybody? Everybody good? Anybody have any questions?
I'm gonna put my email in the chat right now.
Yeah, sure.
And if anybody has any questions, you are welcome to email me, but I will also share it with Shula. Okay. Shirley, are you trying to ask a question?
You're muted, Shirley.
You're muted, Shirley, so I'm happy to answer your questions. I just can't hear it.
On the
Do you know
bottom,
how to unmute?
Shirley, you know how to unmute on the bottom of your screen? There should be like a picture of a microphone. Just click on that. No, asking you to unmute. You're still muted, Shirley.
Unmute.
There you go.
There you go.
Okay, thank you. So where should I put my email? It's down at the bottom.
Oh, there's a place for chat, but I shared my email and Shula will be able to share it with you. So if you have any personal questions that you maybe don't want to share here that you need my help with, you can always email me your question. And if I can get you an answer, I will.